Hello YouTube, welcome to Dr. Vibes, a learning point. In this video, we will study about the different X-rays given in pediatrics. Now this is a sciagram or X-ray that is showing subperiosteal hemorrhage with calcification of the hematoma. Now usually underneath the periosteum, this hemorrhage is not seen, but if calcification is there, you can make out the subperiosteal hemorrhage. Now this is a classic egg on a string appearance that is seen in transposition of great vessels. Okay, the third sciagram you can see, here are the osteolytic lesions that you can see in the skull. So this is a sciagram of Langerhans cells histiocytosis. Now there are some other DDs, that is multiple myeloma in adult and Langerhans cell histiocytosis in case of children. So here you can see multiple osteolytic lesions. Now, this sciagram, here you can see a hazy appearance which is actually said to be evenly distributed small dense defined opacities called as millet seeds. Hence it is called as miliary tuberculosis. Also you get to see this in sarcoidosis. Now in this sciagram, you can see that there is cupping of the metaphysis. Now what do you mean by cupping? So when the osteoid tissue at the metaphyseal end is non-calcified or poorly calcified, it is very soft. So due to the pressure of the long axis of the bone, this soft osteoid tissue bulges outwards and there is widening of the metaphysis. This widening is called as cupping. Here you can also see fraying at the metaphyseal end. What is fraying? Now irregular calcification is occurring in the osteoid tissue. So that leads to a newly formed irregular osteoid tissue, that is fraying. Okay, now you can also see splaying of the metaphysis. So three terms are here: cupping, splaying and fraying. What does splaying mean? Splaying मतलब widening of the metaphysis. मतलब usually क्या हो रहा है कि bone formation हो रहा है, मतलब osteoid formation हो रहा है, लेकिन इतना strong bone form नहीं हो पा रहा है ना long axis की वजह से, इसीलिए this tissue bulges out. That is called as cupping. Widening of the metaphysis is called as splaying. And lastly, fraying of the metaphysis, that is जो irregular calcification हो रहा है उसको हम लोग fraying बोलते हैं. अच्छा, next is the sciagram of the healing rickets. Here you can see a zone of preparatory calcification. Okay, so it first appears as a line of calcification at the epiphyseal end of the osteoid tissue at the junction of the epiphyseal plate. और दूसरा हम लोग को देखने मिलेगा प्रोग्रेसिव मिनरलाइजेशन ऑफ द ऑस्टियोइड टिश्यू. पहले एक सिंपल लाइन हुआ प्रेपरेटरी कैल्सिफिकेशन का, उसके बाद क्या होगा, दिस होल ऑफ द ऑस्टियोइड टिश्यू बिटवीन द मेटाफाइसिस एंड द जोन ऑफ प्रेपरेटरी कैल्सिफिकेशन गेट्स मिनरलाइज्ड. और ये कहाँ से कहाँ तक जाता है, ये प्रेपरेटरी जोन से लेके मेटाफाइसिस तक जाता है. सो दिस इज अ केस ऑफ हीलिंग रिकेट्स. रिमेंबर टू लाइंस, जोन ऑफ प्रेपरेटरी कैल्सिफिकेशन and progressive zone of osteoid tissue. Now this is air fluid level that is classically seen in case of hydropneumothorax. Air is ऊपर में, that you can see the translucent lung fields without any lung markings, and नीचे में होता है the fluid level. Okay, and you will also notice that there is shifting of the mediastinum to the opposite side in case of hydropneumothorax. But यही अगर supine position में ले लोगे, then पूरा lung field में ground glass opacities होगा. Now this is a case of bronchopneumonia, right? In bronchopneumonia, what you see hyperinflation of both the lungs, and there is granular opacities and hazy appearance in between. And that is neonatal bronchopneumonia. This is a figure of 8 which is seen in supracardiac total anomalous pulmonary venous circulation. Figure of 8 on the snowman appearance. This is a sciagram showing mediastinal widening. This may be due to the presence of a mediastinum mass or mass in the mediastinum. Now it can also be due to the Hodgkin's lymphoma, non-Hodgkin's lymphoma, tuberculosis, leukemia, which has involved the lymph nodes. Okay. Next sciagram, here you can see that there is thinning of the inner and the outer table. There is thickening of the inner and the outer table, and there is dental malocclusion. And we have the last sciagram Here you can see the dental occlusion, which I have circled. Now we have another diagram which shows us homogeneous opacities in the entire left lobe of the lung. This is a case of consolidation. Here there is no shifting of the mediastinum, or the costophrenic angle also appears clear. So this is also seen in the case of atelectasis, fibrosis, और यहाँ पे मेडिस्टिनम सेम साइड में शिफ्ट करेगा, कंसोलिडेशन में सेम साइड में शिफ्ट करता है. दिस इज हाइड्रोनीमोथोरैक्स, जिसमें ट्रेकिया और मेडिस्टिनम ऑपोजिट साइड में शिफ्ट करेगा, और जिस साइड में एयर होगा उसमें ब्रोंकोवास्कुलर मार्किंग्स एब्सेंट होंगे.